Hello everyone. So today's video blog is going to talk about sleep apnea and specifically how we judge the severity of sleep apnea. So I'd refer you back to some of my other videos and information if you want to learn what sleep apnea is. So in this video, we're really going to talk about how we classify sleep apnea and what's mild, what's moderate, and what's severe. So the way that sleep apnea is diagnosed is through a sleep study. These days, most sleep studies can be done at home, but some are still done in a sleep lab. From that sleep study information, which is going to measure your breathing and your oxygen levels and those sorts of things for 1 to 2 nights, we're going to be able to find out several important pieces of information. So the first and probably the most important piece of information is called the Apnea-Hypopnea Index, or the AHI. And what this number is it's an average number of times per hour that you either stop breathing or have a significant restriction in airflow. And that number, the AHI, so if it's more than 5 times per hour over the course of your night, you would be considered to have mild sleep apnea. So actually 4 or less times per hour is considered normal for an adult. So with that AHI number, if it's between 5 and 15 times per hour, that would be considered mild obstructive sleep apnea. Above 15 times per hour, but less than 30 times per hour, would be considered moderate sleep apnea. And more than 30 times an hour is considered severe sleep apnea. So that's probably, the AHI is probably the most important piece of information that I get from sleep studies. The other important piece of information, though, would be to look at what your oxygen levels are doing overnight. So if your oxygen levels are staying up in the normal range, that's obviously a better situation than if you're having significant dips below normal overnight. So the Apnea-Hypopnea Index, which is how many times per hour are you stopping breathing, and then the oxygen levels to let me know, are your oxygen levels unstable or changing. Those are kind of the real important pieces of information. And with that information, I can examine you and see what the structure of your throat and your nose are, see if we have any surgical procedures that might help you, or if there are other options for treating sleep apnea. So I hope this is helpful to understand, if you do have sleep apnea, how bad is it? And with that information, you can plan a little bit more about what kind of treatment options you would want to do. So I hope that's helpful, and I'll look forward to seeing you in the next video.